MASLD is a new term. It stands for metabolic dysfunction-associated steatotic liver disease. What that really means is having fat in the liver that's related to having a metabolic syndrome. And the metabolic syndrome is things like diabetes, high blood pressure, high cholesterol. These are all things that can predispose people to have excess fat in the liver and tend to also go along with obesity. There are some people who have fat plus inflammation, and you might hear that referred to as MASH, or metabolic dysfunction-associated steatohepatitis, and that's just a fancy way of saying inflammation related to fat in the liver. And the reason that we care about that specific subset is that fat plus inflammation is what can lead to actually scar tissue formation in the liver. And that scar tissue, usually over the course of many years, can lead to end-stage scarring of the liver, which we know is called cirrhosis. And once the liver has cirrhosis, it's really difficult for it to reverse. We do know that we can reverse scar tissue in the liver for people who aren't quite yet at cirrhosis. But once you actually are at the point of cirrhosis, it's probably almost impossible to reverse to a meaningful degree. So we think that 1 in 3 Americans is at risk or might have MASLD. The thing about it is that it's a silent disease, so many people won't even know that they have it unless they go to see their doctor and they're routinely getting their liver tests checked. The only way to actually prevent this disease is to, first of all, get checked for it to see if you're at risk for it or have it. Because there are certain things we can do to modify our risk factors. For example, if one has high blood pressure, you could see your doctor and get the blood pressure treated. Same goes for high cholesterol and diabetes. Having really good control of those other risk factor diseases is really one of the most important things you can do to fight against MASH.